Let's talk about the differences between general anesthesia and local anesthesia. This is a topic of incredible interest across all forms, patients and physicians. The standard, which I trained on and learned on, was doing surgery under general anesthesia. That means the patient has their homeostatic properties taken over by an anesthesiologist. Fantastic way to undergo surgery. My anesthesia colleagues are exceptional. Patients are well protected and safe throughout the entire operation. The reality of the situation also is that there are significant homeostatic fluctuations that go on during this operation. So when you have a patient who has their surgery under local anesthesia, effectively the patient is maintaining their own homeostatic properties. And what that means is they are continuing to breathe on their own. They are regulating their own heart rate and blood pressure. There are tremendous advances that are coming forward that demonstrate incredible power of the patient's own ability to regulate their heart rate and their blood pressure. What this means is that you do not need these exogenous forces to be administered to upregulate and downregulate the patient's heart rate and blood pressure. And so by working with the patient, giving them comfort, touching, gentle tapping in certain areas, what we're able to do is distract them just a little bit from what's going on at the time of surgery, give them positive reassurance so that they do not need exogenous drugs to address any of their minor fluctuations in heart rate and blood pressure. Entire time during the surgery, the patient is administered injections of local medication. These are sodium channel blocking medications such as lidocaine, marcaine, ropivacaine. Some of these are short-acting, some of these are very long-acting in terms of taking away the patient's ability to detect and feel any of the manipulation that's going on during the surgery. So they may feel some tugging and pulling, but they are not experiencing any pain or discomfort. Through the entire operation, the patient is generally conversing. Sometimes they drift off to sleep, but they are always frequently arousable so that they can give feedback about how they're doing and what they're experiencing. When we're talking about doing facelift surgery, there's a tremendous amount of effort and discussion being put out there today about using a nerve stimulator to try to determine whether or not you're close to a nerve as you're dissecting in the deep plane. This is a big deal. There's no question about it. One of the benefits that comes from doing this operation under local anesthesia is that these individuals can give me the feedback immediately. These motor nerves also have a component of a sensory nerve. And so what that means is, as I'm operating and getting close to these nerves, the patient will give me the feedback and say, oh, I can feel that. Not that they're feeling pain, but that they can feel the sensation that I'm getting close to that nerve. And on top of that, I have my visual feedback tied to their auditory feedback that gives me incredible power about where I'm going and the different dissections and differentiating between a ligament that needs to be released and a nerve which needs to be maintained. This is incredibly powerful and allows for very complete release of those ligamentous attachments so that the SMAS in the deep plane technique can be lifted as that composite flap between the skin and the SMAS to give that patient that youthful rejuvenation that they're looking for. The other aspect about doing procedures under local versus general is the patient contribution. For example, if we're doing a brachioplasty and the patient's asleep, they've got tubes going up and it's a little bit difficult to get access to the patient because the anesthesiologists have their airway that they're needing to protect, which is very important. But when the patient is awake, we can utilize this space around their head to be positioning their arms to have the best access and approach to provide that exceptionally tight but safely tightened brachioplasty, that contour of the arm that accentuates the muscles. So this is a very advantageous way of being able to achieve that beautiful sculpted result. The other operation where we do a significant amount of surgery under local anesthesia is breast augmentation. There's been a lot of talk lately, and Motiva has done a great job pushing the preservé techniques. Really what they're doing is putting these implants in to a pocket that is dissected anterior to the muscle, which is different than going retropectoral. And when you go up underneath the muscle, which was the technique that we were all doing back when we only had access to saline implants in the early 2000s and in the late 1990s, then it was really important to go up underneath the pectoralis muscle to shadow and to create a transition zone from the upper chest down to the breast, because the saline implants have some rippling. And that's just the basic difference between a silicone implant and a saline implant. And therefore, that's why going up underneath the pectoralis muscle was so important. With the advent of phenomenal silicone implants, we were able to move in front of the pectoralis muscle. There are different techniques when you get there. You can go subfascial, which is really the majority of the way the techniques are being performed, that gives you a beautiful positioning of that implant without any of the animation deformities that we so frequently see when you go in the retropectoral or behind the pectoralis. The innovations that are coming from Motiva are that they're placing this implant effectively within the parenchyma or the tissue of the breast. Again, they're very specifically demonstrating that this can be done anterior to the level of the fascia. But the big point about this is that this is an operation that can be done very successfully with minimal discomfort if you're going in front of the muscle. That's where the advantages come from having the operating facilities like I'm standing in here, where we can perform these operations under local anesthesia. Minimal discomfort, rapid recovery. You're avoiding all of the narcotics and all of the medications that lead to the postoperative nausea and discomfort. And then these patients are able to head home 10 minutes, 15 minutes after the operation. It's fantastic. I find that my ability to do surgery is not changed whether I'm doing the operation under local anesthesia or general anesthesia. Having been doing this for over 20 years, I am equally comfortable in either environment, and really I let the patients decide where they would like this operation to happen. Do they want to have it in a private operating suite under local anesthesia, or would they like to go to the hospital and have it done under general anesthesia? Many times the patients will come to me and specifically say, I do not want to have general anesthesia. Everyone has their own desires and reasons for this, but we are able to provide this as an option to them so that they can be comfortable in the decisions that they're making. And my opportunity in this whole process is to educate them what I'm comfortable in doing and demonstrate to them the results that we're able to achieve regardless of which environment they'd like to select. Hope you found this helpful as the difference between general anesthesia and local anesthesia with tumescent. Thanks so much.